Hello, my name is 𝗲𝗃 𝗁𝗱 and I'm a Somali lady. My citizen country is from America and I came here for treatment. But my problem was nerves, neurological, and my doctor was Dr. Zakir, and he done for me a surgery which was a successful surgery with his team, and it was successful. And I appreciate for him as an excellent doctor with his team. The whole staff are good and they are responsible people, and the nurses are very good and they treat you as a family. Thank you, Continental Hospital.
Patient presented with severe pain on the right side of the face, and it was mainly in the lower part of the face, and it was so excruciating that she was not able to brush her teeth, wash her face, and this pain made her not to sleep. She was not able to have a comfortable lifestyle at all, and all this was despite the medications she was taking. She had been taking about 2 or 3 medicines over the course of last 3 years, and these medicines were not helping her at all. In fact, they were giving problems such as dizziness, giddiness, and other things. So therefore, in view of her problems, she was evaluated, an MRI scan was done, and MRI scan and her clinical features were suggestive of something called as trigeminal neuralgia on the right side. Now what this means is that the trigeminal nerve is a nerve which is responsible for sensations over the face, and it arises from area called as the brainstem, and usually there is a space between this trigeminal nerve and a small blood vessel which lies very closely in opposition to each other. Because of some reason, this blood vessel, which is lying close to the blood artery, it starts touching and pulsating against the trigeminal nerve. So it's like this. With each heartbeat, with each pulsation, it hits the nerve repeatedly and many thousand, many hundred thousands per times a day. And this results into short circuiting, and the nerve becomes very, very sensitive to stimulus like washing face, cool air of breeze, brushing the teeth and whatnot. So she came in with the situation of right-sided trigeminal neuralgia or neuralgic pain. And often this condition is misdiagnosed and mistreated by physicians, dental surgeons, and often a tooth extraction is done thinking that is a tooth pain and all. But however, the condition was appropriately diagnosed and we managed this. So if I want to show you in this model what radiofrequency ablation is about. So a needle is inserted into the cheek on this side, and like for example here, and it comes out through an area of the brain where the trigeminal nerve is located, and through this needle radio frequency current is passed, and selectively the nerve fibers of trigeminal nerve are damaged. So this is also a daycare procedure where a simple injection is given into the cheek, and under the image intensifier, under the C-arm, the nerve fibers are destroyed. It looks very appealing that no surgery is required, no radiation is needed, and you are having a pain relief also that. But unfortunately, this is a temporizing measure. It works only for 1 year, 2 years, after which the pain in large majority of patients does come back. So we considered all these options. We had a frank discussion with the patient's relative, and we decided that we are going to do something called as right-sided keyhole microvascular decompression under neuromonitoring. Again at Continental, we are blessed and fortunate to have an apparatus which constantly monitors the nerve functions while we operate, and that leaves a significant opportunity with us not to damage any normal nerves when we are doing surgery. So this is the procedure which was done for her, and results as expected was amazing. She woke up as soon as the surgery was over. She was observed in ICU for a couple of hours, and the next morning she was completely pain-free. She was walking, and the first thing she said when I entered the room was, "Doctor, I am able to brush my teeth again without pain," which was something very gratifying, and which we take things for granted. These small things in life, brushing teeth, washing face, can become so important and so relevant. It is so gratifying to treat these patients when they say that there is no more pain following a small keyhole surgery, and we were fortunate to have her discharged from the hospital within 36 hours of the surgery. I am very hopeful that this is a long-lasting procedure. The chances of a pain recurrence is virtually negligible, with data lasting as long as 10 to 15 years. And I just want to pass this message across so that the patients who are in a similar situation with a similar condition, they are given the right opportunity and right place to heal better and faster, so that they can return to their normal lives as soon as possible.